Good morning. My PhD title is Innovative Technologies in Dentistry, Exploring Digital Solutions for Enhanced Patient Care and Clinical Precision. My name is György Árpád Keskeny. I'm a PhD student and dentist at the prosthodontic clinic at Semmelweis University. My vision is to shape the future dental care by making dental checkups more accurate and available for everyone. And my mission is to explore the role of digital technologies in advancing dental care and precision. I have two specific goals. My first project is about the intraoral scanners, and my second project is about teledentistry. My first project title is Comparing Efficiency of Intraoral Scanning Technologies for Implant Impressions. About the background, in the USA, 46 million people are completely edentulous, and 120 million citizens are missing at least one tooth. This statistic shows the importance for dental restorations, especially for implantations. Dentists always have to take impressions to do these restorations for patients who's missing teeth or those who are requiring implantations. Accuracy is crucial in dental office, as inaccuracies can lead to huge problems. Up to 30% of the direct restorations may have detectable marginal gaps, potentially resulting secondary caries and restoration failure. And we can be always as accurate as our impression was. Basically, there are two kinds of impression-taking methods. The conventional one is often inconvenient, time-consuming, include more clinical steps, and may pose allergy risk due to the silicone materials used. However, we have the digital method, which is made by digital intraoral scanners with digital intraoral devices. Based on the literature, digital impression taking is more comfortable for the patients and for the dentist as well. It needs less chair time, it's more sustainable, and according to the literature, up to 70% of the dentists prefer to take digital impression instead of the conventional method. Here you can see the two main technologies, the two most famous intraoral scanners, the Trios 5, which operates with confocal laser scanning technology, and the CEREC, which operates with triangulation technology. According to the literature, confocal laser scanning technology has a shorter learning curve. That means that dentists can learn to use confocal laser scanning technology more quickly. And also there's a big difference between the technologies because when we would like to scan the approximal or narrow spaces, it is very difficult with the triangulation technology. In contrast, the confocal laser scanning technology, it scans the surface point by point, and it can also scan at different depths as well. However, there's a big difference between the prices as well, because the CEREC costs near $50,000, while the Trios 5 just $20,000. Due to these differences, our research is comparing those two technologies in the terms of clinical efficiency, which is the combination of accuracy and scanning time. Accuracy can be described by trueness and precision, and we always compare the STS file generated by digital intraoral scanners to the reference data, which is made by highly accurate laboratory scanner. And about the scanning time, our main interest is the average implant impression taking scanning time. Here you can see my clinical question. Is there any difference in the accuracy and in the scanning time of intraoral scanners operating with different imaging methods? My population is always virtual model from implants. My intervention is confocal laser scanning technology. My comparator is the triangulation technology, and we have two outcomes, as I mentioned. The hypothesis is that confocal laser scanning technology is more efficient than triangulation technology. And regarding my clinical and research application is to guide the dental practitioners selecting the most affordable and efficient intraoral scanners for their practice. Here you can see my systematic search key where we identified 4 domains. And now we are at we've done with the title and abstract selection, and we are at the phase at the full text selection. Here you can see the flowchart of the selection regarding my first project. And regarding to my second project, which title is Comparing the Accuracy of Teledentistry and Impersonal Dental Examination for Caries Detection. About the background. In the USA, 49 million people live in an area with not enough dentists. Approximately 20% of the US adults have dental issues, but delay or avoid dental treatment due to the lack or cost problems. And moreover, according to the World Health Organization, 2 billion people suffer from caries. In rural areas, many patients need to travel up to 60 miles to see a dentist and wait more than 3 months for a dental appointment. For example, nowadays in Hungary, in 2024, 244 vacant NHS dental posts have been reported. So these areas have been without the dentist for at least 6 months, which is almost 10% of the whole NHS dental posts in Hungary. Teledentistry offers a solution for these problems. By digital tools, smartphones, and other applications, the dental care can be improved in this area. And also, patient education, affordability, and cost is very important because an average dental visit costs near $200, while a teledentistry consultation typically costs $50 to $80. So my clinical question is teledentistry suitable for the diagnosis of caries? We use the PIRD question framework here. Our population is always patients seeking dental diagnosis. Our index test is teledentistry tools used for caries detection. My reference is always traditional in-person dental examination. And my diagnostic accuracy is regarding caries. The hypothesis is that teledentistry is not inferior to in-person examination for detecting caries. And my clinical and research implication is to improving accessibility to early caries detection for patients and reducing the risk of early caries progression. Here you can see my preliminary research key, where we identified 2 domains. And we have already had with the statistician meeting, and we are just now waiting for the meta-coordinator approval. And we hope that the Prospero will be done for the second project by this week or next week. And here you can see the summary of my 2 first projects. I hope this timeline will be okay and feasible for my projects. And I want to thank you for your attention. And then my presentation with the words from Winston Churchill: success is not final, failure is not fatal, it is the courage to continue that counts. Thank you for your attention.
Thank you for your nice presentation. And the presenter is waiting the questions.
Firstly, I would like to congratulate you. You have great presentation skills. So I would like to ask you, what do you think that should be more investigated by teledentistry?
Thank you for your question. Well, teledentistry is part of the digital dentistry, and I hope that in the next few years or in the next few decades, it will be a real part of the dentistry, because oral lesions, oral cancer lesions, caries, and also secondary caries can be investigated by teledentistry. And I also found articles regarding to see that if it's feasible and if it's a good solution for detecting secondary caries. So it's a huge and growing field of the dentistry, and it's a hot topic as far as I can see, the teledentistry. So thank you for your question. And regarding to the future, I hope that teledentistry will be part of the real healthcare management, because it's more comfortable for patients and for the dentist as well. And patients management is, I think, one of the most important thing, because early caries detection is probably the best way to save a patient's tooth, because nothing is sexier than a natural teeth, as the old say goes.
Thank you very much.
Thank you for your nice and interesting presentation. I have a question about teledentistry. Assuming that it's a video consultation, what kind of tools does the patient need from home to be able to take part in this examination?
Thank you for your question. Nowadays, basically, the patients use just smartphones because these smartphones in 2024 and after the COVID pandemic, the teledentistry becomes more popular and more popular, and now with just your smartphones and maybe with your MacBook, you can also have a consultation, make a photo, an intraoral photo, and send it to your dentist. So just with a regular smartphone, with iPhone or Samsung, it's a very an easy way to have a consultation or send a photo, or maybe other applications can be improved because, for example, when you look for an App Store or Google Play Store, you can find right now teledentistry applications or PVA, progressive web applications. It's a kind of application, but...
Okay, thank you very much.
So it's industrial and healthcare factors, so it's a hot topic right now,
okay.
I can say.
Thank you very much for your answer.
Thank you for your brilliant presentation. And I would like to ask you that if there's no significant difference in digital impression technique, then why is it beneficial for us?
Thank you, Dorothy, for your question. We would like to compare the confocal laser scanning technology and the triangulation. Right now, we are not sure about whether the confocal laser scanning technology is as accurate, as good as the triangulation technology. But right now, the CEREC costs near $50,000, so it's very expensive. And the Trios 5 costs near just the half of it, near $20,000. So due to these differences, maybe Trios 5, which operates with confocal laser scanning technology, can be as good as the CEREC. Maybe a little differences can be achieved, but not significant differences regarding to the accuracy. Then the dentist should buy the cheaper one because it's as good as the triangulation. And the CEREC is like... I can say a metaphor for this, that CEREC is the iPhone maybe, and you can say that Trios is the Samsung in a way. So the cost comparison is always very important because, for example, if we find out that there's no significant differences in the accuracy, then we can say that, of course, you can buy both of the scanners. It depends really on the dentist what he or she wants to buy it.